Madam Speaker,
Dr.
Mr.
Madara.
President, members of the board, delegates, and guests. Over the last 5 years, I've used these opportunities to outline the progress in our strategic plan, creating the medical school of the future, dealing effectively with chronic disease as modeled by prediabetes and hypertension, and creating tools and resources to help physicians better thrive. We've made significant and now nationally recognized progress in all three of these areas. And I'll provide a full update at the interim meeting this November. At that time, I can also outline our approaches to help physicians adapt to the macro legislation. That work's already started, but will be more refined once the final rule is established this fall. But today, I'd like to provide thoughts on the emerging digital environment we find ourselves in, and what we might do to move toward digital tools that lead to professional satisfaction and improvements to care, rather than to further practice disruption. But first, I'd like to reflect on the work of our predecessors because there's a lesson there. When the AMA emerged in the mid-19th century, medicine in the US was poorly developed, lagging well behind our European counterparts. Our AMA predecessors engaged in the very heavy lifts of stamping out quackery, creating standards for medical education, and developing the first code of medical ethics. Simply put, the AMA stopped the flow of the snake oil remedies of that time. Quack remedies, snake oil, was all the rage back then. Here's an example. Clark Stanley was raised as a cowboy in Texas and sold a unique remedy which he claimed healed a variety of ailments and healed them completely. Stanley claimed that his body was covered with scars from hundreds of rattlesnake bites, any of which might have killed him but for the benefit of this magical elixir, his snake oil remedy. Since the elixir contained no alcohol, Stanley extended the sale, saying it was suitable for everyone of any age without regard to temperance. A skeptic at the time was the governor of Texas, who in hearing this said, I don't believe there's a better remedy anywhere than whiskey. But it was the AMA that identified these fakes and set standards. Our predecessors did all of this by inserting themselves into the enterprises of the day, public and private, leading massive change by engaging broadly with society. And today, snake oil elixirs are a comparative rarity. Rather, we have really remarkable tools: robotic surgery, new forms of radiation therapy, emerging biologics, and we live in a time of rapid development in the digital world. Telemedicine is an example. It's discussed in detail by this House. But you know something? Appearing in disguise among these positive products are other digital so-called advancements that don't have an appropriate evidence base, or that just don't work that well, or that actually impede care, confuse patients, and waste our time. From ineffective electronic health records to an explosion of direct-to-consumer digital health products to apps, some of which are of poor quality. This is the digital snake oil of the early 21st century. Even those digital products that might be helpful often lack a way of enriching the relationship between physician and patient. It's like trying to squeeze a 10-gallon healthcare product idea into a 2-gallon healthcare knowledge base. More and more, we're seeing digital tools in medicine that, unlike digital tools in almost any other industry, make the provision of care less, not more efficient. And these digital tools often don't connect with each other. Interoperability remains a dream. We were told that interoperability was the future, but Frankly, I didn't expect that it would always be the future. A mark of the age of digital snake oil. Energizing this rush of new products, we find popular books predicting a future of digital healthcare that in the near future will bypass physicians altogether, where patients can largely look after themselves. Now, I have to say, these extravagant claims did achieve their primary goal. Lots of books were sold. These claims also drew the attention of the lay press and private sector, two groups that couldn't have known any better. One highly praised book touted how patients could order their own blood tests by the hundreds. Do it today, then follow algorithms to essentially self-treat. Snake Oil Stanley would have been so proud. So been reading papers of late? Been following the many evolving investigations and apparent fraud of such touted new pathways? That hallucination didn't turn out so well. As one of our presidential candidates might tweet, dumb. Fortunately, more sober analysis of the current state can be found elsewhere, as in Bob Wachter's really wonderful book, The Digital Doctor. A more promising digital future can be envisioned that enhances the physician-patient relationship, produces better and more efficient care, and allows more time for physician-patient interactions. The type of outcome that has been so falsely promised by so much of the current digital snake oil. And Wachter provides no false illusions as to the current state and well describes the present. Something I might call our digital dystopia. From direct-to-consumer digital health devices, which only in the fine print say for entertainment purposes only, to our clunky electronic records, to ICUs that sound like primitive swamps abuzz with a cacophony of bells, alarms, and whistles. Just as in the mid-19th century when we separated the useful antitoxins and compounds like aspirin from Stanley's snake oil remedy, today we're tasked with separating the digital snake oil from the useful and potentially magnificent digital tools. The future is not about eliminating physicians. It's about leveraging physicians, leveraging you by providing digital and other tools that work like they do in virtually all other industries, making our environments more supportive, providing the data we actually need in an organized, efficient way, and saving time so we can spend more of that time with our patients. A new AMA study analyzed a variety of settings and types of practices. 50% of physician time was devoted to the keyboard. 50%. Only a third of their time was free to interact with patients. To compound this, physicians also spent 2 hours each evening on the keyboard, finishing the data entry from the day. Evening hours that used to be spent reading JAMA or decompressing with family. So our current state? American physicians have become the most expensive data entry workforce on the face of the planet. What a waste! And how frustrating. Let's face this 21st century digital snake oil the way our predecessors confronted their task in the 19th century, by inserting ourselves into the processes from which digital tools emanate. So how do we do this? What are we doing about it? What are we working on? Well, to begin with, we're intensively working with vendors, manufacturers, as well as the federal agencies that regulate them. You'll later hear from CMS Acting Administrator Andy Slavitt on enhanced federal pressure for interoperability and efficiency in our health records for EHR 3.0, not 1.0. Now, in retrospect, one could argue that our field was insufficiently embedded in the creation of the first wave of digital products, and the result, defective products that were not informed by physicians. Today, we're active in pursuits toward correcting this, toward having physician knowledge embedded in the development of new products. So here are a few examples. First, we're conveying to manufacturers what physicians actually need. Digital tools that add layers onto our day are not helpful. That's digital snake oil. We hate them. We hate them. In contrast, digital tools that would simplify and better organize our lives and also adapt to the natural variation across our practices, those that would free more time for patient interactions, that's what we want. Tools like that we'd love. Love, love, love. Too few of these today. Second, we're forming interactions with emerging companies that produce health-related goods and services. For example, working with Madara, a Chicago-based incubator for emerging healthcare companies. More than 120 companies are now located in Madara, as well as our AMA interaction space. There, we inform entrepreneurs of the exact needs of physician at the creation of the innovative idea. And by the way, some of you have were prepared and then participated in this, and for that I thank you. We do much better if products and services are deeply informed by our actual problems and needs, rather than flying on an entrepreneur's incomplete view. We bring the granular understanding of the physician-patient environment, and that's difficult to discern from the outside. Third, in January, we launched an innovation studio in Silicon Valley, Health 2047. Health 2047 is in recognition of our 200th anniversary. We'll take many of the problems identified by AMA studies and apply rapid prototyping and design to achieve tools based on physician need. Emerging prototypes will be iterated with physicians until the tool gets it right. This effort is attracting high-level talent in Silicon Valley. Talent that'll be directed to the problems faced by physicians. Fourth, while shaping this future, we also need to address this current state. That's why we're working to identify workflow and practice adjustments that can produce higher practice satisfaction today. These digital modules, which we call Steps Forward, are available to all physicians and can be accessed through our website. I announced Steps Forward last year at this meeting, and since then, more than 70,000 users have accessed these tools to improve practice. New modules are being produced and tested, and CMS has recognized these as a form by which physicians can be acknowledged for practice improvement under the new macro law. These AMA Steps Forward modules have, in just the last few months, received more than 5 national awards in the digital product area. Several of the new Steps Forward modules address pain points highlighted by physicians in a recent AMA crowdsourcing exercise. And thanks again to those of you that contributed ideas. Another crowdsourcing effort, the AMA Innovation Challenge, attracted 23,000 users in 5 weeks and over 100 fully formed product ideas by physicians and trainees. 5 finalists have been selected and will present their ideas at Matter this evening. 3 winners will then be supported in design, planning, and development. Also in this effort, 1,000 physicians indicated interest in helping to pilot and evaluate new such products. I should also emphasize that all this work is being done while we're intensifying our advocacy work. Our work on innovation is coordinated and integrated with our critical work on advocacy. So we're inserting ourselves in both the public and private sectors on behalf of physicians. In the mid-19th century, our predecessors fought the snake oil of the day by interacting with all segments of society, public and private. We simply follow their lead. We're now engaged fully on many fronts, engaging not only the important aspect of legislation and regulation, but also directly engaging those who produce the products and services that will feed our practices. Pipeline products that are now being informed from the start with the knowledge of what physicians actually need. I'll end with something from Bob Wachter's book. Quote, "Even when that wonderful day arrives, when we have finally coaxed the machines into doing all the things we want them to do and none of the things we don't, we will still be left with one human being seeking help at a time of great need and overwhelming anxiety," end quote. That relationship between physician and patient isn't a transactional one, but it is one that requires time. Time that should be made available by helpful digital tools, tools that work effectively as they do in almost every other field but ours. We need that. And we need to be directly involved to make that happen. Because what we don't need is more digital snake oil. Thank you.